Smaller communities in this region continue to face major physician shortages, leaving many emergency departments at risk of closure. The Ontario Medical Association is urging the province to resolve the issue and develop a physician workforce strategy. Jessica Clement has the details.
Regional doctors are calling on the Ontario government to develop a physician workforce strategy to ease the doctor shortage in northern and rural Ontario.
In many of our communities, we only have family physicians, and they are supporting all of the care delivery in the hospital setting. That has meant for many of our physicians that they have needed to make the choice between being in the office, seeing patients who need ongoing care delivered by someone who knows them well, or being in the emergency department to keep that service open.
Dr. Sarah Newberry from Marathon was one of three regional physician leaders brought onto a virtual panel hosted by the Ontario Medical Association to discuss unique healthcare challenges and service gaps in Northern Ontario. Newberry says the region is spread out over a huge geographical area, which creates challenges for delivery of care and accessibility. Dr. Laurel Laxo from Sioux Lookout says the doctor shortage has hit her community hard.
We are currently funded for twice as many physician full-time equivalents than we currently have. And so the impact of that is felt across our region. Many patients tell me that primary care is so difficult to access in Sioux Lookout that it essentially no longer exists. My personal family practice has a wait time of about 4 to 5 months to see me. Of course, the gold standard would be less than 2 weeks.
During the panel, the OMA suggested solutions, which included the government working with the OMA to create a comprehensive physician workforce strategy, creating a provincial pool of locums, and more support networks and hubs in remote and isolated communities. However, Northern Ontario School of Medicine Dean Dr. Sarita Verma says the shortage issue and access to healthcare concerns will not go away until someone takes charge.
There are so many entities involved from multiple agencies and an attempt to consolidate everything under Ontario Health and the Ministry of Health and the regulatory agencies, and now, of course, the Medical Association. And when we want to have a conversation at Nauseam U, we have to often have 50 people in the room. So the one thing we can do in Northern Ontario is identify who's in charge, who is the authority, and who is the jurisdiction to make the change.
Jessica Clement, TBT News.